Hey everyone, and welcome to This Explainer. Today, we're taking a deep, fascinating dive into the human body to solve a pretty massive mystery. Look, if you've ever felt that agonizing, burning pain shooting down your leg, your first instinct is probably to grab some soothing cream and rub it right on your calf or thigh, right? Well, here is the secret we are going to unpack today. Rubbing cream on a burning leg is never going to fix the real problem. Why? Because the trouble isn't actually in your leg at all. Let's jump right into this. Just one single spot in your lower spine controls the feeling and function for the entire back of your leg. Everything traces back to these specific roots in your lower back. So a problem in this one isolated location, it can show up almost anywhere along the line. You might feel it deep in your buttock, it might run down the back of your thigh, maybe it settles in your calf or lands only in your foot. Everyone feels it in a slightly different spot, but honestly, it's almost always the exact same root cause. Which brings us to Section 1, the body's main power line. To really understand how this works, we have to map out the incredible pathway of the thickest nerve in the human body. People throw the name of this nerve around all the time, but very few actually understand how it mechanically works. We are talking about the sciatic nerve. This thing is massive. It's literally the thickness of your thumb. It's built from several smaller nerve roots that branch off your spinal cord, low down in your back. Those roots join into one giant cable that drops down your buttock and runs right down the back of your thigh. Then, a little further down, right behind your knee, it actually splits into two smaller cables, the tibial and peroneal nerves. Think of this whole structure like a main power line. It carries movement commands down from your brain to your muscles, and then it carries sensory signals back up from the skin across basically the entire back of your leg and foot. And this brilliantly illustrates the core disconnect we're talking about. You might feel this heavy, cottony numbness in your foot, or maybe your toes literally feel like they've turned to wood, but the true root cause is almost always hidden deep, deep up in your lower back. This is exactly why those over-the-counter muscle creams are completely useless for this kind of pain. A cream rubbed on your skin just cannot penetrate deep inside your spine to reach the actual nerve that's being squeezed. Moving right along to Section 2, tracing the root cause. How exactly does this crucial power line get pinched in the first place? And what does that pain look like over time if you just try to ignore it? Well, it follows a wonderfully predictable pattern. Over a few days, it usually starts as a simple, dull, pulling ache in your lower back. You probably just think, oh, I slept funny. But then, over weeks, that slides into a deep, nagging soreness in one buttock. Give it a few months, it turns into burning, electric shocks when you cough or stand up. Your leg starts to feel incredibly heavy, almost like lead or cotton. Guys, this is your nerve desperately trying to tell you that something along its path is under serious pressure. Now consider two extremely sneaky ways this pressure actually starts. Take James, for example. He sits at a desk all day, then suddenly tries to heave a heavy dresser across the room. His back hasn't prepared, it spasms, a spinal disc takes a sudden, violent hit and shifts, and bam, he gets shooting pain down his leg. But then, look at Linda. Linda just had a slightly painful hip and walked with a really subtle limp for years just to favor her good leg. Well, that constant limp completely reorganized her walk, it tilted her pelvis, unevenly dragged her back muscles, and slowly, over years, effectively squeezed that sciatic nerve. But here's what's super interesting. What James and Linda have in common is that the mechanical failure underneath is exactly the same. It's an overloaded spinal disc. These discs are the little shock absorbers between your vertebrae. When a disc takes too much load all at once, like in James's case, or an uneven load for way too long, like Linda's, it deforms. It is exactly like squeezing a jelly donut. The soft inner part bulges backward and just crushes right onto the nerve root exiting the spine. All right, let's look at Section 3, red flags to never ignore. We really need to shift gears for a second because there is a massive difference between a pinched nerve that simply hurts and a pinched nerve that is actively dying. Pain is just the nerve complaining, but there's a much more serious signal that means the nerve is failing, and that is weakness. You absolutely must watch for weakness. If you experience measurable weakness, like your leg suddenly gives out, your foot just buckles right under you, or you literally cannot push up onto your toes, you are crossing into dangerous territory. If a doctor examines you and finds that your knee jerk or your ankle reflexes have dropped off entirely, well, it means the physical connection from your spinal cord to your muscle is measurably broken. And that brings us to the most serious level of all. There's a very specific set of nerve roots at the very base of your spinal cord that fans out. Doctors actually call it the cauda equina, or the horse's tail. These roots are absolutely crucial. They control your bladder, your bowel, and the feeling in the saddle area between your legs. If these nerve roots get caught up in the squeeze, specialists treat this as a true no-jokes medical emergency. So the vital takeaway here is to never, ever ignore these specific red flags. There's a documented case of a patient, we'll call him Mike, who basically just put up with leg pain for months, just toughed it out. Then one morning, his leg went totally unresponsive and he suddenly couldn't urinate properly. Mike had to be rushed in for urgent surgery. Waiting too long when these red flags pop up carries a severe risk of permanent loss of bladder and leg function. I cannot stress this enough. Time is absolutely everything here.
Next up, Section 4, Diagnosis and Medical Imaging.
If you're experiencing any of these symptoms, from that stubborn, shooting pain all the way to those terrifying red flags, you need a solid diagnosis. But how do doctors actually look deep inside your anatomy to find a trapped nerve? They use medical imaging, right? But not all imaging is created equal. A standard X-ray is only going to show your bones. Think of it as viewing the computer hardware. It simply cannot show you how a soft disc is pushing on a nerve. And that is why the absolute gold standard here is an MRI. An MRI reveals the software, the soft tissue, the discs, the ligaments, and the nerves themselves. It easily and clearly spots a herniated disc or a narrowed spinal canal pressing exactly where it shouldn't be. Which brings us to our final part, Section 5, Rehab and Lifestyle Changes. Once your doctor has that crystal clear MRI picture of the problem, the ultimate goal is conservative treatment. Basically, trying to fix things without resorting to surgery. But as you navigate this, there are some major, incredibly common pitfalls you really have to avoid. First off, relying on pain pills for years is a massive trap. Sure, they can calm the inflammation, but they basically mute the fire alarm while the structural damage just continues. You feel a bit better, so what do? You go back to lifting heavy things and sitting hunched over, allowing that disc keep wearing down totally undisturbed. You also need to be highly cautious with intense deep massages, aggressive heating, or poorly placed buttock injections. If you have a true disc herniation, aggressively kneading it can actually make the swelling around the nerve root so much worse. So instead of falling into those traps, here is the exact 5-step action plan you should take to your doctor. Step 1, you've got to shift your mindset. Please don't just write this pain off as getting older. Next, show up prepared. Track your symptoms precisely. That leads naturally into discussing imaging, where you should absolutely ask if an MRI is justified for your specific case. From there, you can consult specialists to map out a customized, conservative plan. And finally, step 5, you have to take your daily life seriously as part of the treatment. The bigger part of a lasting result isn't found in a pill bottle at all. It's all about changing your mechanics through physical therapy. You have to build deep back and core strength. You need to steady your pelvis to stop it from chronically tilting, just like Linda's did, and gently lengthen those tight leg and buttock muscles. Honestly, you hold the power to fix this by changing how you move. The whole goal is to spread the load of your body evenly. When you learn to lift heavy things with a straight back instead of rounded, and you take real, actual breaks from long periods of sitting, you take that direct, repetitive hit right off your vulnerable spinal discs and nerve roots. Look, this takes time, but it really works, and it's especially critical as we age, considering that as we pass our 40s and 50s, our spinal discs naturally lose their water content and get a lot less springy, making them way more prone to bulging. So I want to leave you with this final thought. How old are you, and how big of a deal is lower back pain that shoots down your leg in your life right now? Leave me a comment below answering this, because we want to keep mapping out the absolute best strategies for your health. Thanks for hanging out with me for this explainer, and seriously, take care of your spine.